I think it's 3 months.
21-year-old Ayesha is HIV positive. Like millions of South Africans, she takes antiretrovirals to suppress the disease and maintain a healthy level of white blood cells.
So I'll be seeing the dermatologist.
With 6.4 million people infected, South Africa has the biggest HIV problem in the world. After years of AIDS denialism, the country now provides free, universal access to ARVs.
I feel very happy and very grateful, must say, because, you know, in the olden days, I doubt they even had medication to take care of themselves. So with me, when I felt that when I was diagnosed, you know, and they told me about treatment, it was like, oh, okay. So that's great to hear that at least there's a backup plan. There's something that's going to stabilize my, you know, CD4 count and boost me in such a way.
About 2 million South Africans take these life-saving drugs every day. The remaining 4 million either don't need treatment yet or aren't aware of their status. Although some patients suffer from side effects, social stigma or even stock shortages, for most, these drugs have transformed HIV from a death sentence into a manageable disease.
There's one thing about HIV which is important, is that if you take your medication and you are adherent to your medication, that's why we consider it to be a chronic disease like your diabetes and your hypertension.
While that's good news for sufferers, it's led to an unintended change in attitudes. These students at the University of Pretoria say their friends still have sex without condoms and are often more concerned about falling pregnant than contracting HIV.
I find that people don't take the virus as seriously as they should be, especially people our age, because it's ARVs, it's PEPs. I'm fine, I'm okay. There's a plan B, there's a plan C. I've always got a safety net.
South Africa's new infection rate has dropped by around 50% in the last decade, yet it still remains the highest in the world, with 370,000 new infections last year. The United Nations warns that a change in young people's behaviour isn't happening quickly enough, which leaves South Africa with a challenge to provide universal treatment without breeding a culture of complacency.
Yes.